Wonderful. So, hi everyone. Welcome to this Thrivacious webinar on functional medicine. We're excited to have you all here today and hope you find the webinar interesting and useful. And before we get started, I'm just going to give a couple of guidelines. So, if you could mute yourself, please, at all times during the webinar so that everyone can hear the speaker without distractions, that would be great. So, go ahead and mute yourself. And if you have any questions for the speaker during the webinar, just type them into the chat and I will be moderating that and we'll have time for Q&A at the end of the webinar. And for the best viewing experience today, you can select speaker view from the choices in the upper right-hand corner of your screen. And finally, please do note that this webinar is being recorded. We will send out a link to the recording of this in an email after the webinar. So if you want to unmute yourself during the Q&A, that can work, but just letting you know that this webinar is being recorded. Okay, great. So let's just get started with a few intros. So first of all, for those who don't know me, my name is Alana Shaked, and I'm the founder of Thrivacious, and I will be introducing the event today and then moderating the Q&A. Thrivacious is a global community of women who have been touched by all types of cancer, who support and inspire each other to find true fulfillment and thrivership, both during and after cancer. And we've run dozens of workshops, which are now all online, and 2 retreats that aim to transform suffering into healing, dreams into reality, and survivorship into thrivership. Hopefully our retreat will be back at some point in 2021. And finally, before I introduce our speaker today, I just want to give, if you could please mute yourself. Thank you. So finally, just before I introduce our speaker, I want to give a quick disclaimer. So the information provided by the speaker today does not represent the viewpoint of Thrivacious, and this webinar is not intended to provide you with medical advice and is not a substitute for your doctor's instruction.
The woman that I spoke with from California.
Okay, we've got somebody who is unmuted, so I'm going to go ahead and find you and mute you. Thank you. Okay, please, please, please mute yourselves at all times during the webinar. Thank you. Okay. So without further ado, I'm going to introduce you now to our wonderful speaker today. So Paige Woodward, and I'm not even going to try to list all of her titles, but she'll have them up on her slide. But she's an oncology nurse practitioner, and she's the founder of Functional Cancer Care and currently practices at Cedars-Sinai Medical Center in Los Angeles, California. Paige received her BA in zoology from Connecticut College in New London, Connecticut. And her intent was originally to pursue veterinary school, but a post-college job in cancer clinical research at Mass General Hospital in Boston changed her career path. Paige became passionate about cancer care and found herself enrolled at Yale University School of Nursing in the oncology nurse practitioner track. She graduated with a Master of Science in Nursing in 2006 and began her career at Dana-Farber Cancer Institute, treating gastrointestinal malignancies and lymphoma. Eventually, she moved to California, where she has practiced for the past 12 years, treating hematologic malignancies, breast cancer, lung cancer, and gynecologic malignancies. She has extensive knowledge treating patients enrolled in cancer clinical trials. Paige has always had an interest in health and wellness, and she has sought out opportunities to combine her expertise in cancer with her passion for optimal health. She received a certification in nutrition from Precision Nutrition in August 2019 and is currently pursuing her certification in functional medicine through the Institute for Functional Medicine. Paige, thank you so much for being here with us today. I'm going to turn it over to you and I'm going to spotlight you so that everyone can see you. And we're going to go ahead and get started.
Thank you for having me, Alana. I'm excited to share this presentation. And I will say this throughout the presentation, but functional medicine is not, it's a way to add to conventional medicine and a way to supplement your cancer care. I don't think it's the be all end all, but it's a way to help cancer care better. So I'm going to share my screen here. Bring up my slides. Oops. Okay. So the title of my talk is Healing the Body from the Inside Out, Using Functional Medicine as a Tool to Improve Cancer Outcomes.
Paige, I'm not seeing your screen.
Oh,
Let's see if
hold
we
on.
can.
Hold on one second.
There we go.
Oh, sorry about that.
No worries. Now we can see the screen. Thank you.
Sure. Technology problems. Hold on. Can you guys see the?
I can see it. I think you just need to hit. Yeah, there you go.
Okay.
You're in.
All right. Are we all set? Everybody can see this? Okay. So I just wanted to review some learning objectives. We're going to talk about what conventional medicine is, what functional medicine is, how to integrate both functional medicine and conventional medicine, the benefits of using functional medicine in your practice, and how to use functional medicine in cancer treatment and survivorship. So conventional medicine, or what we call traditional Western medicine, is what we all know across the world. It's practiced by medical doctors, osteopathic doctors, allied health professionals, which is what I'm considered, a nurse practitioner, physician assistants, pharmacists. And the goal is to treat symptoms and diseases, often chronic diseases, using drugs, radiation, and surgery. So it's usually you go to the doctor, you say, I have, a sore throat, and either they'll swab it for strep and they'll give you a medication, or say, oh, it's viral, go home, take some Tylenol and you'll be better. So the US, I didn't do this across the world, but globally, according to the CDC, 6 out of 10 Americans have at least one form of chronic disease. And I listed multiple here: heart disease, cancer, lung disease, stroke, Alzheimer's, diabetes, and chronic kidney disease. These are often preventable through lifestyle modifications. And many of these chronic diseases cause a high economic burden on the healthcare system. As healthcare costs are becoming unsustainable and rising, many patients and payers are faced with the frequency of paying for costly disease management. And instead of looking at disease reversal or ways to treat the disease from the root cause, we're paying so much money to our insurance companies, to hospitals. They don't examine the underlying cause of the diagnosis or the health problem. And chronic conditions are encouraged to follow costly and often lifelong medication regimens. And symptoms are not often treated very well. So there's many factors contributing to the chronic disease epidemic. Our nutrition, especially in the US, we have the standard American diet, which is full of processed foods. We've also, killed our farming land, and there's not all the minerals in our soil anymore. We have a lot of environmental toxicity. I think that's somewhat improving, but people used to burn coal and all kinds of things. We're very sedentary. We're not very active. We don't have the sense of community anymore. We used to, back in the day, people used to live in multiple family homes, and there's a community, I think it was in Pennsylvania, and I think there's this community in Italy as well, that they did studies on. And even though people weren't the healthiest, they had their families and their community, and they maintained their health because they had support. We have a world full of chronic stress. People are always on the go. We're not outside and enjoying fresh air. So there's lack of vitamin D. Money's in poverty is an issue, and we have an aging population. Also, tobacco and alcohol are an issue. And this is where functional medicine plays a role. So what is functional medicine? It's a system-based biology that focuses on identifying and addressing the root cause of the disease. So each symptom or differential diagnosis may be one of many contributing to an individual's illness. So what does that mean? So in this slide, we have depression and all these things that are contributing. So in conventional medicine, you would go to the doctor and they would likely just give you an antidepressant. They wouldn't think and stop to consider like, oh, what could possibly be contributing to your depression? And as this slide shows, maybe your thyroid function is off. Maybe you're deficient in vitamin D. Maybe you have something else going on like prediabetes, or you used another medication that caused the depression. And on the flip side, one cause, many conditions. So inflammation can contribute to all these chronic illnesses, diabetes, cancer, heart disease. In conventional medicine, we go straight to treating the heart disease, the depression. We don't think, oh, maybe we should look at an underlying cause. And if we treated the inflammation, we'd likely have an improvement in heart disease, depression, the diabetes. So functional medicine is considered personalized medicine. It asks how and why an illness occurs. It helps to restore health by addressing the root causes and can help transform clinical practice. So this slide I love. This is a common slide we see in the functional medicine world, and it shows the tree and the roots like toxins, poor sleep, negative thoughts, no exercise, digestive problems, poor diet. These are all things we can control and improve. And if you improve those root causes, you're going to decrease the top of the tree, the diseases, the health issues. So like the high blood pressure, the heart disease, the obesity, the cancer. And functional medicine practitioners examine many interactions between the genetic, environmental, and lifestyle factors to improve the outcome and decrease diseases and health issues. I love this slide. So this is functional medicine in a diagram. It uses a broad range of interventions to achieve optimal health. So we look at stress, gut health, emotions, exercise, mental health, supplements, sleep and rest, relationships, and fixing each one of these individually can help promote overall health. So functional medicine is playing a key role in an effort to solve the epidemic of chronic disease that is creating a health crisis nationally and globally. It can provide a common language and a unified model that can be applied across a wide variety of health professions to facilitate integrated care. I love this slide. So it shows the circle of wellness and all the factors contributing to your circle of wellness. This is a true slide of functional medicine, integrating all these issues like activity, nutrition, relationships, help improve your health. And if one of those is off, that can increase your risk of chronic disease. So just a reminder, here's what is considered conventional medicine, and here's what's considered functional medicine. So conventional medicine, disease-oriented, doctor-centered, you're treated the same, your diagnosis is based on symptoms, whereas functional medicine is very patient-centered, holistic. It looks again at the root cause, and we're trying to take a preventative approach so that you don't have all these chronic illnesses. So how do you integrate functional medicine and conventional medicine? You provide a comprehensive plan to treat both the disease and its physical and emotional side effects. And treatments are rooted in scientific discovery and inquiry, but are more natural and less invasive. So let's discuss how to apply functional medicine and integrative medicine in cancer prevention and treatment and survivorship to improve outcomes. Sorry, this is a long slide, but integrative oncology is a patient-centered care, evidence-based field of comprehensive cancer care using non-pharmacologic interventions, so no drugs, and lifestyle modifications alongside conventional cancer treatment. And again, conventional cancer treatment is chemotherapy, surgery, radiation. It seeks to engage patients and families as active participants in their own care from prevention throughout treatment and survivorship. And overall, it optimizes health promotion and proactively addresses symptoms and adverse effects that arise from cancer or its treatments. And this slide is just to remind you, it's very patient-centered care. So let's look at everything that is affecting you. It's not what is on the doctor's agenda. Let's make it about you, which is very important. And I think actually in conventional medicine, we're trying to go to a very patient-centered model and have group decision-making. I just want my disclaimer from the beginning. Alternative or functional medicine should not be used alone in lieu of conventional cancer treatment, because it can have a negative impact on clinical outcomes and associated with a decreased survival rate. So it's important to integrate both worlds for the best outcomes. So I pulled some journal articles to look at using functional medicine alongside conventional medicine. And this was one study that was done with 500 patients with both breast and gynecological cancers. And they used both the conventional and functional medicine world. And they were found to have improvement in their appetite, fatigue, cognitive and emotional functioning, pain, anxiety, sleep, and overall global health. In another study involving 238 cancer patients, they didn't discern what type of cancer they had, used both conventional and functional medicine, and they found that they had less distress overall from their disease, and they were more involved in their self-care. So this model shows how to combine both oncology with conventional treatment with functional medicine. So as you see, we have the medical treatment, surgery, radiation, chemotherapy, targeted therapy, stem cell, clinical trials. But then around this circle, you have how it's important to provide nutrition and exercise and mind body and cancer-proofing your home from toxins and using community support. So, nutrition. Everybody asks about what diet is the right diet to use. There isn't a specific diet to prescribe to you. I always recommend eating whole foods, filling half the plate with non-starchy vegetables. So that's like your greens. If you're going to eat seafood, wild-caught seafood, meat, chicken, eggs should be organic, grass-fed. Purchase organic when you're able. So there's like the clean 15 and the dirty dozen, and the dirty dozen are like strawberries, collard greens, pears, apples. Those are things that you should try and always purchase organic, because they have they have so much pesticide on them. So that's also a toxin that contributes to cancer. You want to drink half your body weight in water and supplement with electrolytes, protein smoothies. If you are suffering from a brain tumor or have that type of disease, they've done a lot of research with the keto diet. And they found that eating a keto diet, which is a high fat, low carb, moderate protein diet, can help improve symptoms and outcomes in treatment for brain tumors. They've used it also in Alzheimer's and epilepsy. And there's a guy at USC, his name is Valter Longo. He's a PhD who runs, I think it's like the geriatric center there. He's done significant research in fasting with cancer treatment. I'm sure a lot of you have heard of the whole intermittent fasting fad that is going on. And he's done legitimate research showing that fasting, like on the day of your chemotherapy or like a 24 to 48 hour window, can actually improve symptom management and outcomes in chemotherapy. And I actually currently have a few patients doing that, and it seems to be going well. But they supplement with bone broth, which has a lot of like collagen and protein in it, and they'll drink electrolytes so that they're not completely depleted. So the next one is exercise. When you're going through cancer treatment, you don't always have a lot of energy. You're usually pretty wiped out. You're pretty fatigued. However, if you can get up and move your body, even if it's for 5 minutes, you're going to have so much improvement. They've done studies that have showed it improves anxiety and depression. People have less fatigue if they get off the couch, get out of their bed. So per the National Cancer Institute, they recommend 150 minutes of moderate intensity per exercise per week, or 75 minutes of high intensity activity. That can be walking, body weight exercises like some push-ups and sit-ups, yoga, Pilates, hiking out in nature. If you're really debilitated from your treatment, maybe a supervised exercise program with a physical therapist would be best. And if you're done with treatment, a lot of hospitals have survivorship programs. And I know we have one at Cedars. It's a cancer rehab program, and they have exercise programs and all different types of things that you can enroll in when you're done with your therapy to try and help improve after your cancer treatment. So sleep is the next factor. This is super critical. Sleep is when your body heals and clears out all the toxins. They recommend 7 to 9 hours of sleep per night. You know, in our society, we do a lot of, we spend a lot of time on our phone, on Instagram, on Facebook, watching TV. All that emits blue light, which can affect your sleep. And that is really, it really impacts it. So sleep hygiene, so using blue blockers if you need to be on screens at night, or having a plan where you shut down your phones, your TV, you know, put things away at nighttime. Maybe drinking a calming tea, reading, taking a warm bath or shower about an hour before you're going to go to bed is a good time to do that, because you want your body temperature to then cool down so you have optimal sleep. And there's some supplements people take at night. Magnesium is one. Also, people use melatonin. I mean, you should be producing enough melatonin, but if you aren't, you can supplement with like 3 to 5 milligrams at nighttime. There are other sleep aids, but if you don't want to use prescription medication, these are the best non-pharmacologic interventions. So mind body stress management, this is super critical as well. They found that stress is extremely harmful to the body. It's probably contributing to a lot of our chronic disease as well. So the more that we can manage our stress and get our mind right, this will help improve outcomes as well. So ways to do this: massage, lymphatic or deep tissue massage, acupuncture. I recommend this to all my patients, and I actually go to acupuncture myself, and I find it very calming. They offer cupping, meditation, either guided through an app. You can go on YouTube. There's lots of free ways to do meditation. Tai Chi, which is just these movements. It doesn't, like, I see people in the park doing it all the time. That can be very calming. Restorative yoga, Reiki, which is an energy healing, and box breathing, which is where you breathe in, counting like 1, 2, 3, 4, and breathe out. So those are all ways to help manage stress, keep the mind body right. Also journaling as well. Some people find that just getting their thoughts out. Community. So this is super critical, I think, in the world of oncology. So what does this mean? I encourage patients to go find support groups where you can talk to people who are going through the same thing. Most cancer centers offer a social work or group therapy. We have our social workers see most of our patients, and you know, some are open to it, some don't want to talk. We also have psychiatrists available that offer therapy for just cancer patients. I think this is a time to lean on your family and friends. Some people don't want to bother them, but you know, let them make you a meal, let them bring you to an appointment, and allowing others to just be part of your life. This is super important. And maybe you find a community through a healer, or going to yoga as your community. an exercise group, a writing group, whatever it is, but community is important. Don't do it alone. Cancer proofing your home. So we have so many toxic chemicals in our lives. And, I think people are becoming more aware of all these toxic chemicals, but cleaning products are full of chemicals we don't want on our skin, we don't want to breathe in. Even products we put on our body, our skin is one of our largest organs. And if we're absorbing like lotions and perfumes and creams that are toxic, that's not, helpful. So one way you can investigate clean products and clean body products is through the Environmental Working Group, or I have the Think Dirty app, and you can literally go into a store and screen the barcode of any product, and it will tell you, and it rates it 0 through I think like 8. And if you have 3 or less, that means you have a very clean product. If it's like a 4 or 5, it's a so-so. And if it's beyond a 5, it's considered a very dirty product. Another thing is to purify the air. So you can purchase, there's multiple different air purifiers. Non-toxic cookware. So Teflon and this non-stick is really toxic. Consider like stainless steel, cast iron, green pans. Get rid of all your plastic. You can absorb toxic chemicals through the storage. I'll use like the Ziploc plastic, get rid of those, move to glass. And if you're going to microwave anything, do it in glass, because when you microwave in plastic, you can absorb chemicals. Also using parchment paper, using wooden spoons to cook instead of plastic or stainless steel. And again, just sunscreen's also another big thing. I mean, we spray that all over our bodies. So again, look for something that's clean. And I might have talked too fast, but we're at the end. So if you guys have any questions, this would be the time to let me know what questions you have.
Thanks, Paige. Do you want to stop the share for a minute, or do you want to, like, that way people can see you a little bit better?
Oh, yeah, I have, sure. I have my screen too with the.
Oh, there we go. Yeah. So we'll also email out this information so that you can get in touch with Paige after the workshop as well. But yeah, let's get into the Q&A. Great. So, okay. So Paige, I'm actually going to start us off. Hang on, let me see if I can put myself in here. Okay, there we go. So I'm actually going to start us off with a little humor. So these are my blue light glasses. I didn't want to spend a lot of money on them because I wasn't convinced that this was real. So these, by the way, guys, are like $30 on Amazon. So you can get a pair of these really, really unattractive blue light glasses for $30 on Amazon. So that kind of like leads us into the first question, which was actually a comment in the chat, which is about cost and affordability. So all of these things that you're mentioning are wonderful, and functional medicine sounds so wonderful. But is this something that insurance is covering? How can patients access this type of care without having to spend thousands and thousands of dollars out of pocket, not only to see a specialist, but also all of these treatments like the supplements, the, having to, redo your whole house with only glass instead of plastic. Like it is very costly. So what do you think about that? And what do you recommend people who are maybe just starting out? Like what are maybe some of the low cost staples that you can get started with?
So some functional medicine practitioners do offer insurance or provide or take patients and use insurance. They'll also give you a super bill that you can submit to your insurance. So if you've hit your deductible, you can get a good amount back. You can also write it off on your taxes. So that's one. Yes, I've been slowly changing over things in my life. It wasn't all at once because it is expensive, but Amazon offers, obviously, I'm sure most people have Amazon. You can buy a lot of things pretty inexpensively. There's also other online ordering like Thrive Market. I don't know if anybody's aware of that, but it's based here, I think, in LA, and they are B Corp, so they give money to other people. They're into using recyclable products. Most of their products are clean, not everything. You kind of have to look closely, but they offer a lot at a discounted price. Um, so you can bulk order, like I get paper towel, toilet paper. They're like a bunch of cleaning stuff from them, and it's all at reduced costs. And it comes in a box, and you can do auto ship. So you can set it on monthly. Um, but I think maybe the first thing to start with is maybe looking at some of your body products. So like sunscreen, lotion, makeup, because that's going right into your skin. So that might be one of the first things you want to start with. And not everything is super expensive. It might be the same price as buying a bottle of Coppertone sunscreen, but you get, I bought something in Whole Foods the other day. It was $8 for a sunscreen that was completely clean. So
Great. I might ask you for that brand because I've been searching sunscreens, and some of these clean sunscreen brands are like, $50 for a
yeah.
little tiny bottle. So great. Thank you for that. So we had a question about the electrolytes, and they were asking like, what do you recommend people drink for electrolytes?
So my favorite, not the cheapest, but they're super, super clean. It's called LMNT, so Element. You can find it on Thrive. You can find it on Amazon. You can order directly from their website. They have multiple flavors. My favorite is the citrus salt. If you drink Gatorade as a kid, some of the flavors sort of mimic Gatorade, but they're extremely healthy. There's no sugar, no additives. I've managed to get free packets. Like people I follow on podcasts will be sponsored by them, and they're like, swipe up and get your free box. So that's how I was able to try. I love them. And, the less water you add, the more salty it is, but it has magnesium, potassium, and sodium in it. Um, I have one actually every day. And I don't know, I love them.
Awesome. Okay. And actually, so we had a question. I actually don't know what this is, but somebody typed in the chat. Um, what type of MGGAT at night? Is that that maybe
Magnesium.
magnesium or melatonin? I don't know what it was about, but yeah.
So magnesium, you want magnesium glycinate. So there's magnesium oxide, magnesium citrate. There's multiple different types. The magnesium citrate and the magnesium oxide are going to cause more bowel issues. If you take too much magnesium, you will end up with a lot of diarrhea. Magnesium glycinate does not really affect the bowels too much. It's very calming. It helps with sleep.
Okay, great. And then we had a question about, so at night, how can you deal with hot flashes? So, I mean, I guess that question is more than just at night, but specifically for those who are not able to sleep at night due to hot flashes, is there anything that functional medicine would recommend for that?
There's different supplements and herbal remedies. I don't know that they work, but black cohosh is one we used to recommend. But again, I don't know how well it works. Electrolytes, I mean, having a fan, your window open. Generally, my experience with hot flashes has been most people need something pharmaceutical to kind of really help them.
Okay, thank you. And then we had a question about, yeah, so how do you know if your melatonin is deficient or sufficient? Like, can you get tested for that?
Not that I'm aware. It's, you'll improve your melatonin if you're blocking blue light, if you're, sleep hygiene, all that kind of stuff. So, and some people are able to nap during the day. If you are going to nap, I would recommend like a power nap, like a 30 minute nap, just to restore yourself. Because if you sleep too long, you're going to impact your bedtime routine.
Okay. And I guess I have a question sort of that kind of plays off of that. So, people are sort of in some ways like self medicating with supplements and vitamins, like maybe they're going to take some melatonin at night, maybe they're going to take some magnesium. And I think some of those are probably pretty safe. But obviously, supplements are, one of the differences from Western medicine is that that's like an unregulated industry, right? So you don't really know what's in a supplement, how it's been tested. And so, what do you recommend in terms of, running things by your doctor, and what's okay and what's not okay?
So I always ask patients to make a list and bring everything in so that I can actually look at it. And trust me, there are plenty of things people take that I have no idea what they are. And in the cancer world, if you're on chemotherapy, a lot of these supplements can interact with the chemotherapy and make it not effective. So it's really important, that we know what people are taking. So my recommendation is looking for like pharmaceutical grade supplements, meaning they're really clean. There's no additives. So I have actually a website linked to my website called Fullscript, and you can order basically pharmaceutical grade supplements. And then, so companies that are really clean are, there's Thorne, which I think they're based out of Chicago. They're really clean supplements, Pure Encapsulations, Seeking Health. These people all have websites too, but Amazon sells some of their products. You just have to look at what you're ordering, but things I think that are okay during cancer treatment are like magnesium, vitamin D. Most of us are deficient in vitamin D. Our normal range is about 30 to 100. You should be looking to be somewhere 50 to 70. So that would depend on how much you want to take. That's okay. Like a probiotic is really good, I think, to improve gut health. Melatonin's fine. Those are like safe things. And then it depends what else people want to be on. But, like fish oil and like turmeric and some of those, the anti-inflammatory supplements can, cause the blood to thin, and then we have to be careful with chemo. So.
Yeah. Okay, great. Yeah, I actually have run into that problem with the fish oil, taking too much fish oil and then having a bleeding episode. So
yes,
it's good that people are warned about that. So someone has asked here, what about cooking with aluminum foil?
It can, you can. I would try and switch over to parchment paper to line like a cookie sheet, like roast your vegetables on parchment paper. Aluminum foil you can absorb some chemicals through that when you're cooking with it.
Okay. And so the next question was, parchment paper is bad, toxic, ? But no, I think what we're saying is that parchment paper is sort of the safest option.
Yes. And you can get like unbleached, they sell it everywhere, like the brown one. It's usually compostable.
Oh, okay. I didn't even realize that the bleaching was an issue. So now we know you got to get the brown parchment paper. Okay.
And if you get the unbleached or the bleached, whatever, it's a step in the right direction.
And then someone asked, this is a great question, are any of these toxin chemical avoidance measures evidence-based?
They're doing a lot more research on this. I don't have like articles in front of me to support all of this. But, I've listened to a lot of podcasts, I've read a lot of stuff, and they're slowly linking, certain chemicals that are in like Teflon and different things like the BPAs from plastic, that they're carcinogens. And even some of the chemicals that were in like Coke and cereals we probably all ate as a kid, a lot of carcinogens.
Yeah, I mean, I actually, I don't know so much in like the cancer context, but I do know that in the fertility context, there is like a lot of studies that talk specifically about this, and it's like really actually quite serious. So yeah, I do think that there, at least in that context, there is a lot of evidence that supports that. Okay, so the next question is coconut water a good source of electrolytes?
Yeah, it's great actually. It's clean, it's got a lot of potassium in it, so it's a good way to hydrate.
And then someone asks, are there any common supplements that affect chemo that we should avoid?
So I sort of mentioned this before, but like the fish oil, the turmeric, curcumin, a lot of people want to take those, and I have no problem because they're anti-inflammatory. But they can thin the blood, they can cause bleeding. And then like high dose vitamin C is something you want to avoid because the antioxidant can actually impact the efficacy of the chemo. Like all the high dose, like, people always ask if they can go get these like vitamin infusions. I would do that in survivorship or as a preventative, not in the middle of chemotherapy. And sometimes some of the herbal supplements that like people come in and, we don't even know what some of these chemicals are. And we have some databases we can do research and they can impact the chemo as well.
Okay. And then let's kind of go more to a practical level. So, like, let's say that you've just been diagnosed with some type of cancer. How do you actually integrate functional medicine? So, like, you've just gotten diagnosed, things are moving super fast generally. You see the oncologist, they're like, we're starting chemo on Monday. So, do you reach out to a functional medicine doctor at that point, or is this more something that, like, later on would be more appropriate? Like, what do you recommend to patients?
You could go either way. I mean, some people are so overwhelmed with the initial process that, they need time to kind of like settle into like, okay, we're going to do chemo, we're doing surgery, we're doing this. But I think one step you can take is just improving your nutrition. It's going to help you with the chemo. It's going to help you, just long term. And, if you're in a cancer center, they should have an oncology dietitian. We have several, and we always make sure our patients, I do some education with my patients, but I get like 15-minute visits. So it's not a lot of time. But we always send everybody to our oncology dietitian because it's super important, for protein and just making sure they're hydrating, keeping their calories. And
Great. And I guess sort of piggybacking off of that last question, I think, there are more and more doctors who are becoming more open to integrative medicine and functional medicine, but there are unfortunately still like many traditional Western medicine doctors that are very resistant to this type of care, almost to the point that they will sort of be like, I don't want you doing that. So how would you recommend talking to your Western doctor and being able to integrate that? Like, does the functional medicine doctor communicate with the Western medicine doctor? How do they make sure that that this is sort of like an integrative situation for the patient?
so I would hope one that as a patient, you would tell your provider, like, I'm interested in this, or I'm seeing another physician, like I'm on these, like we need to know. A lot of them I don't think share with us. And, we don't always know what they're taking. So I think for one, share with your, physician, your oncologist that, I'm taking these supplements, I'm working with a functional medicine doctor. And then hopefully the functional medicine doctor and your oncologist will talk and communicate. We have some patients doing both, and it's nice when they're sharing with us, like, and asking us like, hey, I would like to put the patient on XYZ. Are you okay with that? Sometimes we are, sometimes we aren't. I encourage patients, like I try to talk to the ones that I know are super interested about this stuff. About doing acupuncture, nutrition, exercise, just trying to integrate things. So it's still, yeah, I think, like you said, doctors are becoming more open to it. Some are still very skeptical. So it's a slow process.
Okay, great. And I guess when somebody first starts out with you or with, someone who's doing functional medicine, is there like a slew of testing that you guys do? Like, do you do like a bunch of, blood tests? Like what's kind of the framework for that?
It depends. I mean, you meet with the functional medicine doctor, practitioner, whoever, and talk about like, okay, what are my goals? What's bothering me? What are my symptoms? And then you kind of go from there and figure it out. I'd say the common ones that functional medicine doctors test are gut health. So they'll look either like stool, they'll do like a food sensitivity panel. Sometimes they'll run hormones, like deep dive, not the things that you get in your typical medical office. Like they'll go, and draw like a really intense panel of stuff so that they can really look at the whole picture. But I think really looking at like the gut, you know, is really critical, and looking at stool and food sensitivity.
Yeah, and I guess in that regard, so I wanted to ask you a little bit about survivorship. One of the like major complaints that we hear about in our group, in our community, and also something I personally, as a breast cancer survivor, am very familiar with is, you know, you finish your treatment and the Western medicine doctor sort of like sends you off back into the world, and you know, most of us are like, whoa, you know, emotionally obviously is one thing, and then also physically there's a lot to cope with. And
Mhm.
one of the biggest complaints is fatigue. So I was just wondering, with survivorship, and specifically fatigue, like how does functional medicine approach that issue?
So, for one, they're slowly trying to integrate like survivorship clinics into oncology. It's still a work in progress where people are getting, you know, in the survivorship clinics that have been established, people are getting their routine screenings. They're making sure not just for their cancer, but they're getting their other health, you know, screenings. Like if you had breast cancer, we'll make sure you're getting your colonoscopy. And yes, fatigue is a huge, huge issue. So exercise is one way to help kind of start combating that. And it, again, it can be, as I listed, it can be on your own. It could be through a guided program. At Cedars, they have this one physician, Dr. Asher, who's an oncology rehab physician. And I know other big cancer centers have that. And he has offered all these programs to help with like the cognitive changes. A lot of people complain of like brain fog and, you know, they're forgetful. So he has integrated all these programs to help people like start working through fatigue and all of that. And I think it needs to be a guided, you know, way. And I actually will offer people physical therapy to kind of help rebuild their strength. So,
Okay,
I
great.
mean, supplement wise, I don't know. I think obviously eating a clean diet, maybe supplementing with, you know, like a fish oil and yeah, I don't know, probiotic, those things might help you, but it's going to take time. I always tell people it's a marathon to recovery. It's not a sprint,
Yeah.
as
Mhm.
you know.
Absolutely.
It takes many, many months.
Yeah. And then I had one other question, and please,
Sure.
anyone else who still has questions, feel free to write them in the chat. But my sort of last question for you has to do with diet. So it's like, I feel like every day we hear something new, right? Like, first, it's like milk is super healthy for you. And then now it's like, no, milk and lactose are the devil. And then, you know, it's like, you know, this type of sugar is okay for you. And now it's like, no, sugar is absolutely out, right? So, one of the biggest trends that I think in the cancer world people have been seeing is this recommendation to eat a plant based diet, which I think for some people is great. And then, you know, for others, myself included, is really, really challenging. Like, I eat meat. You know, I don't feel good when I don't eat meat. And so, what I'd like to kind of ask you, because you mentioned eating meat and you mentioned that, like, you know, grass fed, organic is appropriate. So, I know that, you know, all of these studies about plant based diets don't really take into account the organic grass fed component. And so I'm wondering if you are aware of any ongoing research or just like what your thoughts are about, you know, is it really that you shouldn't be eating any animal products, or is the real issue what's in that animal product?
So the real issue is what's in that animal product. And the reason even though it's more expensive, just think of it as an investment in your health. The grass fed, like in the wild caught, is so critical. They've shown, if any of you shop at Costco, there was a study that came out, you know, everybody used to go buy their rotisserie chickens. Everybody raves about, I don't have a Costco membership, but everybody raves about their rotisserie chickens. And they found that they were just so full of hormones, and they were these like huge rotisserie chickens, and they found that they came from these farms that they just kept injecting them with hormones, and then their breasts got so big that they like toppled over and were so unhealthy. And so there's this movement to kind of make sure that animals are not, you know, shoved full of hormones, because when we absorb those, you know, that's toxic to us. So I think it's not a bad thing to eat meat or eat fish. Just look at where it's coming from. And the other thing is to look at this. There's a new movement for regenerative farming where I know there's some up in NorCal and other parts of the world and the country, and they're trying to like fix the soil so that they're, you know, using the farming to put nutrients back in the soil, and you know, the meat is really clean. The plant-based diet thing, you need plants in your in your diet. I think that you're missing a lot of vital nutrients when you just eat solely plant-based. I think it's hard to get adequate protein. So.
Okay, great. And then we have one other question here. Any thoughts on cell phones and or Wi-Fi radiation, etc., causing or aggravating cancers? Great question.
Yeah, I know there's been studies about it, yet we all are super attached to our phones, myself included. I'm sure, you know, it emits, there's blue light, there's all kinds of stuff that it's emitting that I'm sure is contributing to, you know, and they say like, don't put your laptop like right directly on your lap, like in your, especially for women, well, men too, but, you know, for your fertility. So.
So would you recommend, like, what would you recommend? Like using headphones or maybe keeping your cell phone out of your bedroom at night? Like what
Yeah.
would be sort of.
Yes. Some people like put their cell phone away so that it's not close to them. It's not emitting the blue light. Yes. Using headphones. And I have those Apple like iPod or AirPods that are wireless. One physician was telling me he's really skeptical of them and thinks they're really dangerous. And I was like, great. So, you know, I don't know, like you just at some point have to pick and choose, but apparently the wire earphones that go into your cell phone are safer.
Interesting. Okay. Yeah. I've
Yes.
always been thinking about like the Bluetooth waves that are just like running
Right.
around our planet now and what that actually means. And okay. Well, I think that is the end of the questions. Again, we will email out Paige's information. So yeah, that brings us to a close. And I just really want to thank our amazing speaker Paige again. That was an incredible presentation, and I learned so much from that. I hope you all did too, and really appreciate everyone participating today. As I said, we'll send a recording of the webinar later this week, and I'll include Paige's contact information that she also shared on her screen. Yeah, and just last but not least, as you all know, or maybe don't know, we're a nonprofit organization, and we rely on donations to be able to deliver workshops and webinars like this one. So donations to Thrivacious are tax deductible in the US, UK, and Canada. So if you're in a position to make a donation so that we can create more programs like this one, we will also send out a link to make a donation in that email. So thank you guys all so much. Oh, I see someone just entered the waiting room, but we're about to close. So unfortunately, that person who's just coming in now, you will get the recording. And that brings us to a close. So thank you so much again, Paige, and thanks to everyone who's joined.
Thank you for having me.
All right, everyone. Yes, a very essential presentation. So important that we all talk about these things and start to learn how to protect ourselves. So thank you so much, Paige, for the information. And wherever everyone is in the world today, have a great day or evening. Take care.
Bye.